I'm Josh Cutler. I'm a licensed clinical social worker and have been with Providence for about 4 years. And I'm a manager of the Behavioral Health Concierge Program, and I'm also one of the behavioral health providers. So this program started back in June, and it's run by telehealth at the system level, where we provide same day and next day mental health appointments to caregivers of our health system. So we see physicians and nurses and support staff and all of their dependents. And to date, we've had over 1,500 visits. We're getting really great feedback from folks. I'm finding it to be some of the most meaningful clinical experience that I've had to date, just taking care of people that are taking care of people. So engaging with our caregivers that are on the front lines, especially during this difficult time with COVID, to be there with people through these just really challenging times. One thing I love about working for this organization is there is a lot of interest from leadership and throughout the organization around caring for caregivers. It's a challenge that I think we're all aware of. The levels of burnout are significantly high for doctors and nurses and other folks working in the system. And there's a lot of systemic challenges that we're looking at as an organization. But one of the key areas to address when you're trying to take care of people that are struggling with burnout is to make sure that mental health resources are accessible. So in addition to the program that we've created, which gives people quick access virtually to behavioral health providers, we're working with the health plan to create a more robust mental health network, as well as working with a number of digital tools to make sure people get access to good quality information on the internet, whether that's computerized cognitive behavioral therapy or videos and podcasts and other things that really provide good quality mental health information. I'm also doing some work to support a peer-to-peer program that we're developing. So if a caregiver has a bad outcome, say in a surgery or something else happens in the hospital, rather than just go straight to mental health, not everybody wants to do that, they'd have access to a trained peer who could support them through what they're going through. So there's really a lot going on, and it's really exciting to be part of it. There's an awful lot of work to be done, but it's fantastic to be working with an organization that's so committed to this issue. The stress meter, yes. I affectionately like to call it Dr. Wagray's stress test. And Dr. Wagray is Dr. Arpan Wagray, who's my boss and a mental health leader in our health system. And he and a small group of us were trying to think of a way. We've created access to a number of different services for mental health care for folks, and we were just trying to think of a good way to direct people really efficiently to the right level of care. And so the concept became this stress dial, which evolved into a stress meter, which pretty quickly you can click on it. It has 10 smiley faces. Some are frowny and some are smiley, from red to green, and rating the level of stress from mild to moderate to severe. So you click on one of those, and it then takes you to a set of resources that are most appropriate for the challenges that you're facing. So the Telebehavioral Health Concierge Program is one that you'd have access to. Silver Cloud, which is our cognitive behavioral therapy partner on the computerized side, they also are a resource. Credible Mind is another resource which offers us videos and podcasts and vetted content. We even have access to telespiritual care. We've got our chaplain group here in the system was able to create something where you send them an email and a chaplain will call you, so we were able to build that in. So there's really quite a lot we were able to build into this meter, as well as some of the traditional HR programs through our Choose Well offerings, and some regional telehealth behavioral health offerings for caregivers that have been developed. So it's awesome to have one place to send people when caregivers ask me, I need some help, how do I figure out what I need? Why don't you go here? There's going to be some offerings, a menu that you can click on, and then get directed to the right level of care for you. And it's all free to our caregivers. It's been fantastic. We've had thousands of people click on the stress meter Certainly a little bit more at the front end when we were promoting it most widely, but we continue to have a fair amount of traffic. And I've seen it definitely in my program where I'm having a lot more people calling us. Our volumes have been higher in the last 2 months than they ever have been. And so that's been exciting. But we've definitely had just across the board an uptick in access to all those services. And so as difficult as this crisis has been, I really see it as an opportunity for people that maybe weren't able to reach out for help or weren't seeing these resources available. I think we're all talking about how we're stressed out in a way that maybe quietly people acted like they were fine before. So it's become a little more normalized to talk about your stress, and now normalized to talk about resources that can be helpful. Yeah, it's definitely interesting, and in some ways it makes me kind of sad because these are issues that people have been dealing with well before this. I'm finding in my work that people are stressed out about COVID, but it's on top of family stress, marital stress, depression, anxiety, other mental health issues. So those stresses aren't going away. The COVID crisis has just made them worse. But people are also I think more and more goes in our bucket of stress, and when it starts to overwhelm and overflow, that's when people start to reach out for help. And so I think that's in some ways what's happening. The COVID is just overwhelming people and then pushing them to get help, which and I think it's also bringing to light the significant shortage of mental health providers in our country. And I'm excited for what telehealth can bring to making things more accessible, especially in rural areas. But it's definitely just highlighting the crisis that was already there, and the crisis for burnout for mental health providers, or for healthcare providers, particularly physicians and nurses. I was just reading something that was written before this COVID, and it was calling that a pandemic or an epidemic. And so this is certainly just making that more challenging. Oh yeah, we have ramped way up. It's been really interesting experience for me, having gotten into telehealth about a year and a half ago, and a lot of my behavioral health colleagues were like, why would you do that? Like, don't you want to be in the same room with people? And I was like, yeah. I wasn't necessarily interested in the telehealth part as much as the ability to help caregivers across multiple states, and that's enabled by these virtual tools that we have through telehealth. And now those same colleagues are calling me saying, how do you do this, Josh? This is harder than I was expecting, and there's really a steep learning curve. And so I have been enjoying, educating my colleagues on how to use these tools that are available. And in the system, we're the telehealth team that I'm on. I mean, we've just rolled out, I think it was probably about 7,000 licenses to providers across our system. We've got an engaged team that has been working every day to get these out. And that's not just behavioral health, that's primary care providers, other specialty care providers, so that our patients still get access to their doctors and their counselors, even in the midst of this crisis when nobody can come into the office. And so those are things that we're making possible. Certainly still our visits are down, but I was just on a call today with a group that was trying to figure out how to do virtual group visits for partial hospitalization programs, for cancer support groups, for other behavioral health things that we treat in the system. I found it to be really meaningful to just hear this group of committed clinicians trying to solve for these issues, to be able to keep providing this care. We have a group over at Swedish that does pain management. They have a program called Functional Restoration that I actually worked in for a little while when they were down a psychologist, and they are moving their whole program virtual. So that's physical therapy, occupational therapy, relaxation therapy, visits with a psychologist, and also group visits with a nurse educator. It's an amazing program, and the fact that they are able to operationalize this in a virtual way and to keep it going for these patients who are really at risk for a lot, including what we know has happened with the opioid crisis, some of that addiction and other things. And so it's been really just heartening for me to see my colleagues in the face of such significant challenges when they aren't able to be in the clinic, still embracing this technology and making it work, and having a health system that has the resources to support them to be able to take care of their folks virtually. For the first couple of weeks, I was like stir crazy, and I don't know how this is going to be, and can I handle much more of this? And then I am now in this place of acceptance where I just decided that this is going to go on forever, and should just get used to it, and I'll be surprised when it ends. But I am privileged enough to have a job that I can work from home. So does my wife. Like, our kids are home, but we're managing to make it work most days, where I think for many people that are out of work and maybe even were already on the edge of being able to pay their rent every month, and now suddenly that job is gone, and unemployment claims are higher than they've ever been. It's kind of hard to imagine a more hopeful future, and so in an economy where things can be so up and down, and sometimes people's mental health can be tied to just how comfortable they are, the context of their situation. I think that can be definitely part of it. I worry a lot about the suicide rate, and I know that's something that the Wellbeing Trust and as a health system we've been really focused on, bringing down those deaths of despair. But in a time where people are out of work, maybe more people will be homeless. There was already a lot of inequality in our society, but it's probably going to get worse before it gets better. Suicide can be a factor. As hard as things are right now, and as challenging as things as this has been for our mental health, and certainly I'm talking to couples right now who are not necessarily in domestic violence situations, but who had maybe some challenges in their marriage they were ignoring, and then when they're home 24/7 together, they suddenly are having to face them, and feel that myself right at home right now. But also, I think if we can shift our attention a little bit from how difficult and painful and really uncertain the future is, and appreciate that we are able to slow down in some ways right now. We are able to maybe connect with people in a new way. I've talked to more family members over Zoom recently that I don't see very often than I ever did before. And I could have done that before, and it's not like they live in North Carolina and California and around the country, but suddenly it's like we need to have those interactions. We all talk about Zoom. Like, my 3-year-old daughter had her birthday a few weeks ago, and we sang happy birthday on Zoom with multiple family members from all over the country that would not have been at her birthday party, and we wouldn't have thought to do that if COVID wasn't here, but here we had that, and it was just such a nice way to connect. And I would say, even for my own relationship with my children, I'm finding just a lot of sweet moments during the day that whether it's just being able to have lunch together on a weekday, or having my toddler sitting next to me watching her little show in my office while I'm in a meeting. She always makes me sit in the folding chair, and she takes my comfortable desk chair. But I know how things stand. So those are the pieces with this. It's easy to focus on how bad things are getting, and I don't want to ignore that. But there is also some silver lining to this if we can appreciate it, and focus on loving the ones we're with. So I would say the main advice I'm giving people is to slow down and get present in the moment that you're in, because that voice that you described, like, I can argue against it all day long, but you're going to have a million reasons for, I am uncomfortable, and this is why this isn't working, and so we can try to counter that, or we can say, okay, I'm having these thoughts. They're definitely distressing, but do I have a way to turn the volume down on them a little bit and shift my attention to what's important? I mean, for how long have we maybe said, I wish I had more time to just slow down and be at home and not have to go do all this stuff? Well, guess what? Here you are. So if you ever made that wish, I just want to call you out and say you asked for this. And so what are some of the things that you you would do if you were just home and this wasn't such a crisis, but you were just choosing to be home. So whether that's, I hear puzzles are totally sold out, but whether it's a board game with family or reading that book, or please like stay informed, but don't read the news all day or watch the news all day. That's just going to be a recipe for making you crazy. But finding things to do that are just in your present experience, and do certainly what you need to do to prepare for the future, whatever that involves, whether it's like, filing your taxes and getting that money, or whether it's, looking, if you have a small business, looking into some of the small business loans to cover payroll. But whatever you're doing, trying to be proactive, something that's moving you forward towards this totally uncertain future. But the reality is the future has always been uncertain. And it's just that right now we just have no roadmap at all. Going forward, I think it's about setting an intention. Like, how do I want to spend this time? For me, like, I ate all the junk food and chocolate in the house for the first week, and then it was like gone, and I gained 19 pounds or whatever. Exactly. But then I next time I went to the store, I didn't buy that stuff, and I bought toilet paper and the essentials. And I also made a commitment, like, I want to cook more. And I've been working an awful lot this year on off hours, and I haven't been cooking as much, and I really like to cook. So aligning your activities with your intentions, and if there's crap in your house that you shouldn't be eating, just throw it away. Like yesterday, my buddy and I, that we ride bikes together typically every weekend. We rode the Seattle to Portland ride a few years ago. He was like, oh, I'm going to go for a run later. And I was like, oh, I should do that. Let's go at the same time. So I actually went for a bike ride at the same time he went for a run. And then we talked later, and it felt like kind of accountable to him. So I think if that works well for you, having some accountability. And again, this time of social distancing doesn't mean we can't pick up the phone and be connected. But also paying attention to, there's a part of us that is grieving, of things are not the way they should be or the way they were. This isn't the life that I wanted. And so that's the part probably that wants to just slow down and snack and eat and hang out with Netflix. And I totally get that. But are you just doing that unconsciously? And so try to be more conscious about, okay, I'm going to eat these Pringles and I'm going to watch Quibi now for 20 minutes. That's my new thing. And I'm going to work in the garden, or I'm going to go get some exercise. And it can start with just once around the block, and then, lengthen it out from there. So we based it on the subjective units of distress measure, which is a pretty standard psychometric measure that's used in research and in clinical work around anxiety. So we started with that, and then built that into our own scale with some pictures that were a little more engaging, and then really looked at, and I actually was the one that did it, just looked at like the level of distress and matching it to the appropriate level of resource. So for example, someone that's having some anxiety, some stress, but is not at a high level, it's pretty appropriate for them to have access to Credible Mind, which is good resources for like depression, anxiety, but it's articles, TED Talks, things like that. Kind of a low lift, but sort of the self-serve stuff. Also the computerized cognitive behavioral therapy programs, Silver Cloud. We have the stress module and the resilience module are available for free for all caregivers, and we have some additional modules around depression, anxiety, and insomnia that people can have if they see us through Behavioral Health Concierge as well. So those are some of the options there. Also telespiritual care. People might necessarily be having serious mental health issues, but there can be some spiritual questions or existential issues that would be really helpful to talk with the chaplain about. So that's sort of on the low end. And then at the moderate end is the telebehavioral health, behavioral health concierge program, and then also the Choose Well programs, which gives you access to our traditional EAP, as well as the spiritual care and the SilverCloud and Credible Minds. So there's definitely some overlap. And then on the severe end, we also have our telebehavioral health, because our counselors are able to manage crisis situations. Certainly if someone is having a high level of distress where they're thinking about hurting themselves or someone else, we'd rather have them call 911 than us. And also people have access there to the traditional EAP. So really quite a range of resources based on this SUD scale. I would love this to be your go-to resource if you're struggling with things and don't remember what all's out there. Well, there was that stress meter. I found that helpful, and click on that and then look to the resource that you're most comfortable accessing. Cognitive behavioral therapy is the kind of gold standard evidence-based treatment for depression and anxiety and a number of other conditions. And computerized cognitive behavioral therapy is basically just that, a computerized version without a therapist. Some of it is coached, so there's someone that logs in and sort of encourages you, maybe talks to you a little bit about your work that you've done in the program, but you're pretty much on your own. And there's a lot of cognitive behavioral therapy manuals out there that, as a therapist, I often recommend during the course of treatment. Why don't you try this manual that's going to take you through these worksheets, these exercises. They'll really help with the challenges that you're facing. And so the computerized cognitive behavioral therapy program, there's a lot of evidence. They've done a lot of research, and we did actually a program. We looked at I think they narrowed it down to 40, and then we looked at 40 programs pretty closely, and then we narrowed it down to 2, and one of them is what we're using, SilverCloud, which is a company out of the UK. So it's something that I hear the people that really do engage with it find it to be really effective, and it's a nice adjunct to the work that I'm doing with people, but also something people can do on their own, especially if they're not wanting to go talk with somebody or they don't have time to do that. I would just say, well, just do it. It's something that is confidential. We're tracking how many total clicks, but I had a medical director recently who was asking me for granular data for one program, and I said, I'm sorry, I can't give you that. We built this so that we wouldn't have access to that level of data. So it's entirely confidential to click on the stress meter. Nobody's tracking your identity or your IP address that way. And then when you do reach out for resources, they are also all completely confidential, restricted at a high level, where my service is confidential to the point where we put it in a restricted department that most caregivers wouldn't even have access to in your medical record. So yeah, it's something that people should definitely do. Everybody that I've talked to that has clicked into the resources has really appreciated the variety of things that are there. And I think that's a key piece to call out. It's not just therapy, that there's articles and other resources that you can get access to. So the goal is to just continue to make sure that we have the most high quality vetted resources there, and in some ways to continue to build out the content of the current resources. So Credible Mind, for example, they source content from around the internet, and then they have experts rate it and also can curate. So we're having a number of our experts in the system as curating professionals in Credible Minds. So, for example, I've got a page on there, several of my colleagues, several of our medical directors, and also if we're able to publish some things, they'll go there. But they're also continuing to build their platform. They've just recently launched some great content on the COVID-19 crisis and ways to get emotional support there. Also, SilverCloud is just about to launch a Caring for the Caregiver COVID-19 response program, in addition to what else is on their platform. And so that's there. And we continue to have meetings with external partners who are interested in working with us, and we're just really careful about what we bring in. But I think that we'll continue to evolve it. And every time people come back and click on those resources, things are going to be a little bit different and better. Well, I think there's a couple of things. One is people are just really busy and really focused on, I think, surviving in the day-to-day. And as caregivers, we get so many emails. It can be a little overwhelming. So sometimes the word, maybe it's there, but you just miss it amongst everything else. I know that we've been doing a great job of promoting it, and people are still certainly using it, but we've got thousands of caregivers that would really benefit, that I'm sure have not seen the stress meter yet. So I think just continuing to spread the word, especially through local leadership. I'm finding that when core leaders bring it up on a call, that can be really powerful. I've been on a few calls that I was invited to from local executives this last week, and I just put the link in the chat box and I say, click on it right now while I'm talking, and encourage people to click through it right there. But I can only be on so many calls. So I would encourage our leadership, if you're listening to this is a fantastic tool for your staff that's really quick. You can just share the link, show it for really briefly in a staff meeting, and let people know these resources are available. And so I think there's just many ways to continue to get the word out, and also reaching out to the people that are being reached out to by the people that need help. And that's not always the traditional HR route. Sometimes it is, but sometimes it can be those charge nurses, the medical directors, the kind of unofficial leaders of the floor. And so continuing to be aware of who those folks are and trying to get this tool in their hands to spread the word about is going to be really important. And that's a big part of our work right now. Even if you're quote unquote feeling fine, I would look around at the quality of your life and relationships right now. So if you feel like my mood's fine, I'm not depressed, I'm totally fine, but you're snappy and irritable at home, or you're withdrawn and disconnected from your spouse or your kids, or you're finding that you're just having more trouble staying on top of things or organized with your work, or conversely, you're not setting boundaries, and all kinds of folks want to work on well-being projects that have to do with telehealth or other things. I'm not talking about myself. Learning to draw some boundaries around, what's reasonable for you to do during this time, because also sometimes we can dread slowing down, so we just keep adding more on, and that can really be unhealthy. So finding a way to slow down appropriately and acknowledge, like, this is really hard and stressful, and it's okay to be overwhelmed. You're in good company with all of humanity right now, and you're not going to be swallowed up by it, especially if you're able to reach out, especially use that stress meter and get connected to the resources that you need, because there also can be a lot of profound healing and meaning in falling apart and being put back together. We've been through worse as a species in humanity. Certainly our generation, this feels like maybe the scariest thing we've ever had to face, and it may well be. But I think back to my grandparents who lived through the Great Depression, and others farther back who immigrated here, and some of the challenges that they've faced that then have led to me being able to sit here and have this conversation. And so just to be reminded that the human journey is a very difficult one, but also one that's full of hope, and we will get through this. And so just to take the time to breathe and appreciate the spring weather that we're having right now. It's been certainly amazing in my neighborhood, and just because we're social distancing and we can't go out a lot of places, we can go outside in our backyards or for a walk and enjoy the people that we're with. So really, I would take the time to make the most of this moment and remember not just the tough craziness of all of this, but make some memories that are really positive too, because there's a lot that you're not going to remember from this year, but you're going to remember this time. It's just the way our brains work. So let's add in some things that are really positive about it as well.